Hi guys, it's Dr. James from Highton Vet Clinic, and today I'm with one of my daughters. This is Maple. Today we're going to talk about what to expect when your female dog comes home after a spaying or a desexing. So typically at Highton Vet Clinic, all the patients are arriving in the morning. They have their blood work and everything done during the day, their surgeries again during the day, and their recoveries in the afternoon, and typically they go home in the mid to late afternoon. What you might notice after surgery is an area of skin clipped up on one or both legs, and that's where we've placed typically an intravenous catheter. The catheter allows us to give us things like methadone and pain relief. It also allows us to give the anaesthetic agent to make them go to sleep. It also allows us to give them intravenous fluids for the duration of their procedure, which has helped maintain their blood supply and their pressure of their kidneys and so forth, and lets them metabolise the anaesthetic quite well. The other thing which you'll find is some patients actually be clipped on the underside of their neck. And the reason we do that is to take blood tests, and that's their pre-anaesthetic blood test, which you've often heard about before. So typically the pre-anaesthetic blood test is just making sure their liver function, their kidney function, all those type of things are quite normal. If the vets have got concerns, they may have touched base through the day and they'll no doubt explain what they were concerned about. Other times it allows us to modify their anaesthetic protocols. The other big thing with the female dogs, you notice, their tummies will be shaved, the hair will go back, don't stress, and they'll have a little incision, generally the length of their tummy and stuff like that. What that's allowing us to do is actually remove like a full ovarian hysterectomy, so removing their ovaries and their uterus. What we'll also find is then the skin will be closed. There'll be a skin layer, a fat layer, a muscle layer of stitches. You'll only see the skin layer. And then from the dog side of thing, what we ideally want is not to lick the wound for the next couple of days. So some patients will go home with the old bucket on their head. And that's designed to be long enough so that they can't get their little noses over the edge to lick the wounds. If you're worried, I do recommend you have a look at the wound after surgery if you're not too grossed out by blood and so forth, because what we'd like to do is have a reference point as to what normal might be. What we don't want to find is the wound is spotting blood, or it's getting quite red or getting quite inflamed, or if it looks not quite right. We'd rather give us a ring and be on the forefront so we can check the wound out a bit earlier. If the wound will go to plan, what we do is typically see back at the 3-day mark, just to make sure with the nurse that everything's healing quite nicely. After surgery, they will be given some pain relief, and they'll go home with some extra pain relief for the days that follow, because it is an intra-abdominal surgery and pain is subjective, and Maple and other cavies alike and other dogs sometimes aren't the bravest. The other thing you'll notice is too, because they have been anaesthetised, sometimes their tummy's a bit sensitive for the next 24 hours. So often we recommend something like Hill's ID or some bland food like chicken and rice for a couple of days after, just to settle their tummies down. The other thing to mention is too, because they have been anaesthetised today, some patients don't regulate their body temperature as well as they should. So keeping indoors and keeping them warm is important for that first night after surgery. Assuming you get through that and you see the nurses back at the 72-hour mark, they'll reassure you hopefully that the wound's all okay. Typically then we'll see you back at the 10 to 14-day mark, and then we'll be removing the stitches. And from the dog side, I think that's kind of where the story ends from the surgery. The wound should be nice and clean, should have healed by then. We typically allow them to go out and do their normal type activities. The other thing too is you can finally wash them for those dogs who've been dying to wash for the last 2 weeks as well. But guys, I hope that clarifies what to expect when your pet comes home from surgery. If you've got any concerns, don't hesitate to give us a call. Otherwise, that'll be it from Maple and I. See you soon. Bye. Say bye-bye.